So then we look at the health advocate. And you know, I have met with a number of seniors groups over the years that had great plans for a seniors health advocate or a seniors advocate, and they had it all set out, and they involved volunteers that were going to offer services in the community, and it was very low cost, volunteer driven. Some great ideas, which every time we brought it up to the government, they got blown off. So I was very interested to see the idea that there would be an appointment of a health advocate in here. But again, when I look at it, what's the job of the health advocate? Okay, to look at complaints and to perform any other duties that are set out in regulations. Well, again, everything's going under regulations. This is completely a shell bill. It allows that there could be employees that are able to assist this health advocate, or one presumes be this health advocate. And then it talks about the kind of complaints they can take. But well, what can they do with it? Can they adjust it? Can they enforce it? Can they make something happen? No, they can review it. Wow. They can review the complaint. Okie dokie then. Well, that wouldn't take it very far, would it? If they fail, that someone, if they find in their review that someone has failed to do what they were supposed to under a health charter that's a guideline and doesn't have any guarantee of enforcement or any legal standing, that'd be interesting to watch. Then they can do what? They can demand, they can enforce, they can move something. Oh, no, wait, they can make a recommendation. Wow. Okay, so when you've seriously had a problem with the healthcare system and you go to the advocate reviews it. Isn't there a song from a musical, something about reviewing the situation? It's Fagin, whose response to everything was to review the situation, and I sometimes think that he might be the mascot of the current government administration, to have Fagin reviewing every possible situation. It is, however, a catchy tune, so maybe everyone can hum it. So once they've reviewed this situation, if they do find that there is a problem here, then they can make a recommendation, and they may make a recommendation, not that they must, but they may, and they could submit a report, could, not have to, may again, but not must, submit a report on the matter to the minister. And what does the minister have to do? Nothing. They don't even have to respond to it. So that's not very effective either.